Boond Soch ki, powered by Dr. V. N. Brims, Peritoneal Stroke Management and Ajmera. Today on ttalk platform, we are again having Dr. Sanket Mehta. This is a series of an episode basically to health related and as far as the surgery which is concerned. Dr. Sanket Mehta, welcome again to the show. Dr. Sanket Mehta is a very well-known name in the country in the field of cytoreductive and HIPEC surgery, and also the president of the Society of Peritoneal Surface Surgical Oncology of India and director of SSO, Specialty Surgical Oncology. So, welcome once again. Now, basically in the Indian context, when we talk in terms of stomach, many Indians suffers from acidity and gastric so can you throw some light as far as stomach cancer which are concerned?
So stomach cancers, in fact, India has a very high incidence of stomach cancer in certain parts of India, like Orissa, Tamil Nadu, etc., where it typically happens in low socioeconomic area in high salt intake population. Mm-hmm. It's also very common in the northeastern India where there is this habit of having processed meat and smoked meats, mm-hmm. and high salt is used, or pickled mm-hmm. foods are used with preservatives. Mm-hmm. These are known risk factors for stomach cancer. The typical acid reflux disease can sometimes cause Barrett's esophagus, which is a precancerous condition, mm-hmm. that involves the junction of the esophagus and the stomach, mm-hmm. and that can later develop into a G junction, that is gastroesophageal junction cancers. Mm-hmm. And one more important causative factor, which is eminently preventable, is H. pylori infection. H. pylori is a bacteria that often takes seed in your stomach through contaminated food, so mm-hmm. street food, mm-hmm. and if not treated on time, it gives not only acid reflux disease but also causes stomach cancer.
Okay.
So it's a preventable cause of stomach cancer. Yes.
Good. Doctor, also one of the food which causes the stomach cancer.
Yes. As I mentioned, smoked foods. So smoked foods typically have nitrosamines and N-nitroso compounds, which are known to be carcinogenic for the stomach. Pickled foods with high salt content, mm-hmm. Which is not uncommon in India, but is very common also in other Eastern countries like South Korea and Japan, also mm-hmm. leads to high incidence of stomach cancer. Mm-hmm. And we also have other things like smoking, mm-hmm. and high frequency of food intake can sometimes cause stomach cancer.
Okay. What is the role of an endoscopy in terms of
endoscopy? Yeah, endoscopy is a very simple test in which, under a little bit of sedation, a scope is passed into the stomach to directly visualize the entire lining or surface of the inner side of the stomach, mm-hmm. and diagnose these tumors by either helping us take a biopsy, mm-hmm. Or by performing what is sometimes called as an endoscopic submucosal resection, mm-hmm. Where a very early tumor can be directly treated as well, mm-hmm. with endoscopy. Of course, it requires special skill set and special equipment, but endoscopy is the only way to diagnose a stomach cancer.
Mm-hmm. Many times if we'll see in India, as a stomach pain which is concerned, people they try and take some desi stuff to ensure it chale jayega. Is it the right way of going into the things?
So any symptom like acid reflux or pain in the upper abdomen, which is not relieved by common medications in 5 to 7 days, mm-hmm. needs evaluation by an endoscopy. Mm-hmm. So if you have taken medicine from your family doctor and the symptoms are not relieved in 2 weeks, mm-hmm. you should undergo an endoscopy. It can not only help you diagnose stomach cancer, but also the predisposing factors like H. pylori infection or acid reflux disease, mm-hmm. which can later lead to stomach cancer.
Dr. Sanket Mehta, what is the treatment as far as stomach cancer which is concerned?
So, in early stage stomach cancer, as in stage 1 and stage 2, the single most important modality is surgery, mm-hmm. where you remove the affected part of the stomach. Stomach is a very capacious organ, and you can easily remove a part of the stomach and join the small intestine to the stomach to restore continuity, mm-hmm. without impacting too much the quality of life of the patient. Mm-hmm. For advanced tumors or tumors situated in the proximal part of the stomach, you can remove the whole of the stomach. We also need to, in both instances, remove lymph nodes, which are glands linked to the immune system of the body, where the tumor has the most likelihood of spreading as a part of the surgery. Majority of the times, this surgery can be performed by minimal invasive techniques like laparoscopy or robotics. And in advanced cases where it has already spread to the surrounding structures, we use a combination of chemotherapy followed by cytoreductive surgery with or without HIPEC, and further treatment with either chemotherapy plus immunotherapy to treat the advanced malignancies.
Dr. Sanket Mehta, thank you very much. I'm sure the target audience are listening to you as well as stomach cancer, which are concerned, and the kind of advice what you're giving to them, I'm sure it's going to help them as far as to lead that healthy life. Thank you very much for being part on the show. God bless you.